A team of volunteers from Langford has returned from its second trip to Haiti this year. The group is following up on its first visit to rebuild an orphanage that was destroyed in the earthquake in January. But what they found this time was another disaster, the outbreak of cholera. More than 1,300 people killed, 23,000 others infected, and those are only the reported cases. A News went back to Haiti with the Langford group and found a shattered nation now facing a silent killer.
When A News visited Haiti 10 weeks after the earthquake, it was hard to imagine how the country could cope with the massive destruction and countless deaths. But on our second visit, we found ourselves staring into the eyes of even more misery, an outbreak of cholera that is ravaging the population.
Our fear is a large-scale nationwide outbreak with a death toll way and above what it could and should be in a cholera outbreak.
The breeding ground for cholera is everywhere. Disease-filled puddles left behind after Hurricane Tomas, canals carrying garbage and human excrement, and hundreds of crowded refugee camps packed with people left homeless by January's quake.
Oh my God, you have to ramp up so fast.
The UN calls the cholera epidemic the second humanitarian disaster to hit the country this year, and believes quick action from aid organizations will barely slow the outbreak.
We're saying a caseload of 200,000 is realistic. That's not an invented number. That's based on what we know about how epidemics work elsewhere.
And the UN expects the death toll from cholera to be far greater than the normal 1% seen in developed countries. It's why health officials from all over the globe are focusing their efforts on Haiti's capital, Port-au-Prince, where urban slums are providing doctors with a daily supply of seriously ill patients. Infection control here is taken very seriously. Since the outbreak was first discovered in Port-au-Prince, organizations such as Doctors Without Borders have been setting up cholera treatment centers. In this center alone, there are 100 patients. But officials here say in the coming weeks, even the beds here won't be enough. A few steps away, workers are feverishly building more beds that will end up in another cholera treatment center. This camp expected to house another 320 patients.
If the case continues to increase, for sure we cannot take everybody, because I think it will be a big disaster.
With the number of cases doubling every week, the disease is only adding to the country's already overburdened healthcare system. Vancouver nurse Rose Patterson is one of hundreds of Canadians volunteering in Port-au-Prince to help the country recover from the January quake. She spends her day caring for patients with TB in a government-run hospital barely coping with an infection that ballooned after the disaster. It is a far cry from BC Children's Hospital, where she normally works.
At home, there isn't ever a question of whether there's oxygen available for them, whereas here there is. Oxygen is always a big problem. It's very expensive, and we only have a limited amount. And of course, these patients with TB are a lot of them really need it in order to survive.
In an attempt to keep people out of hospital, officials are visiting areas at the highest risk of a cholera outbreak. Refugees in camps are being taught how to prevent infection. Simple steps such as an instruction on how to use a washroom, washing hands, and clinics to encourage women to breastfeed their babies and not to use water or food that might be contaminated. Officials say the education campaign is a delicate balancing act, offering enough information to prevent spread of the disease while not trying to instill panic in the Haitian people. It may be too late. Candidates running in next week's presidential election are already calling for the vote to be postponed. The UN wants the election to proceed for many reasons.
One possibility is that we piggyback on the elections process, and we use the polling station system and the mechanisms for moving polling papers around to actually distribute public information around cholera as well.
And the word appears to be getting out. Workers are cleaning up the normally garbage-laden streets. And people who used to bathe in filthy water at the side of the road are now choosing to use a clean water supply. It's the beginning of what the UN suspects will be at least a 6 to 9 month process. But one thing the World Organization knows, even when the epidemic is over, cholera is in Haiti to stay. In Port-au-Prince, Stephen Andrew, A News.